pandemic continues to strain on one, the county health systems, two, the lives of Kenyans, and three, the country is currently facing resurgence of the third wave. Despite the sustained countermeasures by the county governments to address the pandemic, there is an increased pressure from emerging variants, such as the Delta variant and others, that are proving to be more transmissible and violent. These variants have contributed significantly to the surge of infection rates noted in Western Kenya region. However, the region has been overtaken by the following 6 counties, which have reported the higher number of infections: Nairobi City, Mombasa City, Nakuru, Kiambu, Nyeri, and Kilifi. Currently, the positivity rate is 15.4%. This is very high. We must strive to reduce the rate to the WHO recommended rate of below 5% and thus flatten the curve. Notwithstanding the foregoing, there is some good news. The testing capacity has been boosted in the counties with additional 17 PCR machines distributed in the month of May this year. I commend the Minister of Health for filling the much needed PRC machines. On the same breath, we appeal to the Minister of Health to now go a step further by providing the counties with the much needed testing reagents and rapid testing kits. Impact of the COVID-19 on mental health. There has been an increase of mental health illness due to the stress and anxiety associated with the impact of COVID-19. One of the most prominent manifestations is the rise of suicide cases. This has increased from 317 cases recorded annually in the past years to over 417 recorded this year, an increase of 100 cases. To avert this trend, county governments have heightened their surveillance and health promotion programs, such as counseling, aimed at addressing the mental health related issues. Additionally, counties are working closely with community health volunteers to ensure the vulnerable groups access the necessary mental support where need arises. The bed capacity in 33 counties during the last 3 weeks is as follows. 1, isolation bed. There's a total of 7,566 beds in isolation facilities. Currently, 1,287 beds are occupied, bringing the total number of available beds to 6,279. But of course, there has been an increase. ICU beds. Cumulatively, there are 512 ICU beds in that one counties. Currently, 192 ICU beds are occupied, bringing the total number of available beds to 320. This therefore indicates that there is an increase of patients who require critical health care. HDU beds, cumulatively, there are 284 HDU beds in the facilities. Currently, 162 beds are occupied, bringing the total number of available beds to 122. This also indicates that the number of patients who require critical care has increased. Oxygen capacity. There has been a rise in the number of patients that require critical care, and demand for oxygen is therefore very, very high. To this end, the county governments are scaling up processes to avail oxygen, medical oxygen, especially at the level 5 and 4 hospitals. This is being done in collaboration and our partners, mainly the World Bank, USAID, and Global Fund. Further, counties have interventions, including procurement of additional gases and liquid oxygen to match the increased demand, extension of piped outlets, and repair of non-functional oxygen generation plants. These measures will be complemented with the installation of additional plants. We call upon the partners to continue working with the county governments to avail medical oxygen and infrastructure improvement in the health facilities. COVID-19 vaccination. As at 1st August 2021, a total of 1,062 413 vaccines, which account for 21.1% of phase 1 targeted population. And a total of 661,314 people received the second dose of the vaccine, which accounts to 62.2% of the total vaccinated in phase 1. The vaccination rollout is as follows. For the first dose, healthcare workers, 174,965. Security officers, 91,081. Teachers, 160,000. Above 58, 361,292. Others, 325,071. For the second dose of vaccine, healthcare workers, 115,540. Security officers, 52,000. Others. We are glad to note that there has been a higher uptake of the second vaccine dose by the targeted population. We urge the national government to fast-track procurement and delivery of COVID-19 vaccines to scale up efforts so as to achieve the targeted vaccination coverage of 10 million. Home-based care. As at 1st August, there were 2,225 patients under home-based isolation care across the counties. In this regard, we urge all asymptomatic patients to continue working with the community health volunteers in the implementation of the home-based care guidelines. Non-COVID-19 pandemic issues. Drought management, food and nutrition security in ASR counties continue to deteriorate, with arid areas severely affected due to the drought. The drought is expected to continue until February 2022. This, coupled with the impact of COVID-19, has threatened the livelihood of ASL populations. To address this issue, county governments are implementing social protection initiatives, which include cash transfers, supplementary feeding of vulnerable population, and 3, expanding water tracking to areas and institutions without water. Further, county governments are working closely with the national government, development partners, civil societies to mobilize resources to support the affected counties in order to scale up these interventions. Transport sector. County governments remain vigilant on the operations of public transport. We continue to tighten the measures imposed in the transport sector to curb the spread of virus. This has been done through ramping up hand washing and sanitation points in the buses and matatu terminals. Additionally, county governments have strengthened county transport safety committees. The committee is working with all the relevant stakeholders to sensitize the citizenry on the adherence of transport protocols. Gender. COVID-19 continues to widen the existing inequalities for women and girls and discrimination of already marginalized groups, including people with disability and those living with extreme poverty. In this regard, counties have come up with intervention to caution the vulnerable groups from the effects of pandemic. Some of these measures include: 1. Setting aside special funds to caution them from the adverse socioeconomic effects of the pandemic. 2. Provision of dignity packs for the women as well. 3. Sensitization of the public and the duty bearers on prevention and response to gender-based violence. 4. Medical waste management. We also note that there is still an influx of medical waste that is not disposed in a safe manner. This continues to pose a great risk to the members of the public who interact with the waste materials. We therefore call upon all the county governments to ensure segregation of waste is undertaken at source. To enhance proper disposal of medical waste, such as personal protective equipment, we urge counties to provide well-labeled waste segregation bins and ensure compliance of Ministry of Health guidelines on medical waste disposal. 5. Water connectivity. Water is a key component in the fight against COVID-19. In this regard, we urge county governments to ensure uninterrupted water service provision in isolation centers and in all the public spaces. In areas with minimal water service levels, standby water tanks should be filled to guarantee constant water supply in order to observe the health guidelines on hand washing and hygiene. Now, we have a category here we are calling challenge. You remember that in June, we had a very good supply of funds from the National Treasury. Now we are in August. Finance. We note with concern the statement by the Control of Budget to deny county government's access to funds as a result of pending. Important for the Office of the Control to recognize that approval on requisition of funds is based on County Government Appropriations Act. Purely the mandate of the county assemblies and the Senate. We therefore discourage the Control of Budget on such attempt, as it would be overstepping the mandate of the Office of the Controller and disrupt service deliveries by county government. However, 17 counties have already concluded their 2021-2022 budget, and they should be provided with funds. The 30 which have not complied, I wish to ask my colleagues to HPD so that the 30 remaining also conclude the budget and approves the budget so that we can now avail funds for July. Continue observing the public health protocols. We can only flatten the curve and reduce the number of fatalities if we work together. As county government, Chacha. Okay. Right. Okay. Very good question. We have been consulting with the necessary officials. We are working very closely with the Ministry of Health. They are represented in our planning committee, which is preparing for devolution. They are also participating in the steering committee, which is co-chaired by my deputy, the vice chair, COG, and co-chaired by CS devolution. And we have decided we may have to scale down the numbers from 5,000 to 3,000. Number two, we have also decided that we work very, very closely to monitor the situation of new infections, COVID-19 infections, so that we do whatever is possible to really bring it down, so that we really hold this 7th devolution conference, which is the last, and is important. We are also taking an extra measure. That is, we have a system now, we are able to tell those of our delegates who have been vaccinated, who have received 2 doses of the vaccination, and those who have not received. So we are very, very careful indeed. We are taking all the precautions because it's critical. We hold this devolution conference, but we scale down the numbers for sure. Yes.
My name is Vincent Afande from Radio City.
Mr. Vande?
I just need clarification. You did say that the 17 counties that have already done their budget.
Yes.
And 30 are yet to do.
Right.
What are the reasons why are these 30 counties have not done their budget? And another question, the 17 that have already done their budget, have they received their people's share?
They have not received their share yet, and that's what we are telling the controller. For those who have complied and uploaded the budget, they should receive their July share. Those who have not complied, we are now appealing to compromise with the county assemblies, because sometimes it's supremacy battles between the executive and the assembly, so that finalize this exercise within. We are communicating to the governors who have not complied. Yes, please. Yeah, there are some counties which are fully equipped. There are some counties which are fully equipped with oxygen. One of them is mine, Embu County. We have a very powerful machine which we procured, and it produces 800 liters per minute, so we are well off. I think also Meru is doing well. Kakamega, they have now a new equipment, and quite a number of counties are now upgrading there. All the governors are trying their best to ensure there is enough oxygen. Are we through? Thank you. Asante.